morning, faculty, family, friends, and above all, class of 2026. Today is your day, and you have earned it. It is the culmination of your passion, ambition, and optimism for a better world. You worked hard to arrive at Harvard Chance School and worked even harder when you were here. And I know you'll continue to work hard because this is just the beginning of what you'll accomplish. You are now part of an extraordinary legacy. Upon receiving your degrees, you join a community of people who have changed the world. And I have every reason to believe you'll do the same. Each of you will go on to do remarkable work, and the range you'll cover together collectively is exhilarating. Let me honor you and all the various missions you'll take forward. Now listen to how many areas of expertise you have developed. Let's start with those of you who will spend your careers working with data and quantitative methods. I want to celebrate you. You'll design studies, evaluate interventions, and generate results that help translate evidence into action. You have chosen a path that's at the core of public health, always has been. Every landmark achievement in public health, from vaccines to treatments to life-saving policies, rests on a foundation of rigorous data and robust statistical methods. And you help ask the right questions. You design the studies that answer them. Then you draw the conclusions the data support. And it's a time when the world is overflowing with data, from clinical trials, electronic health records, genomics, environmental exposure, infectious disease surveillance, and even our phones and watches. Your skills have never been more important because you know that data alone does not improve health. It takes people like you to turn data into evidence, evidence into understanding, and understanding into action. So thank you for all the contributions you'll make. Now, let's turn to those of you who have chosen epidemiology. You are the detectives of public health. You follow the evidence to understand who gets sick, why they get sick, and what we can do to prevent illness before it happens. Your work spans diseases, populations, and communities. And at Harvard Chance School, you learn to identify patterns and to seek causes. You describe risk and inform prevention. By studying populations, you improve individual lives. Right now, at our school, your field is tackling some of the most pressing public health challenges of our time, including, for instance, cancer. You and your colleagues are identifying biomarkers for early detection, studying what determines who survives and who thrives, and try to understand why cancer cells spread. And that's just one example. You're also working on cardiovascular disease, trauma, mental health, and much more. So you have the skills needed to join the fight against these diseases and many more. Epidemiology graduates, congratulations. Now, some of you chose to study diseases down to their roots because many of the biggest challenges in public health begin with the smallest mechanism of life. And so you know this. To understand conditions such as obesity, diabetes, cancer, cardiovascular disease, and aging, we must understand what's happening inside our cells, how our body produces and uses energy, how metabolism changes over time, what happens when these systems break down. The same is true for infectious diseases. Tuberculosis kills more than 1.2 million people every year, and nearly every minute, a child under 5 dies of malaria, mostly in sub-Saharan Africa. To defeat these diseases, we first have to understand them at their most fundamental level. So you ask questions that begin with molecules but benefit millions of people. Can we prevent or treat metabolic disease more effectively? Can we slow down aging and extend healthy lives? Can we stop a pathogen before it becomes a pandemic? Whether you spend time in our schools' labs, peering into cells, or studying how pathogens spread, your work will lead to the same place. More children celebrating their 5th birthday, more families staying whole, better prevention, better treatments, and longer, healthier lives. You have pursued science with profound implications for human health, and we are grateful to you. Thank you. Now, I want to turn to those of you who chose to pursue an essential question. How does the world around us promote our health or make us sick? You study the air we breathe, the water we drink, the chemicals we come across, and the places we live and work in. You will expose hidden dangers and drive the policies that improve people's health. You join a long and proud tradition at this school. Let me take you back to the early 1900s, when workers in mines, in factories, and construction sites showed up every day to jobs where they could be crushed by machinery, poisoned by chemicals, or killed by explosions, with few regulations to protect them. Our own Alice Hamilton helped change that. Her work led to one of the first state workplace safety laws in the country. She helped lay the foundation for the landmark Occupational Safety and Health Act of 1970, the first ever federal law to protect workers in America. And she was also the first woman faculty member at Harvard ever, at a time when not only all faculty, but even all students were males. And today, all of you inherit and take her legacy forward. So thank you for that. And next, some of you have dedicated yourself to unraveling the relationships among nutrition, health, and disease. You identify what strengthens us and what harms us. Then you translate that knowledge into the policies and interventions that help people live longer, healthier lives. And our school has a long track record of doing that. Let's take the Nurses' Health Study, which started in 1976 and is one of the largest and longest running investigations ever conducted. The Nurses' Health Study helped overturn the idea that all fats are bad. And that finding changed dietary guidelines and the way people around the world eat every day. And now you carry that same practical curiosity and are ready to work with communities to promote healthy nutrition. So congratulations to you. In public health, we know health is shaped by much more than biology. It is shaped by how we live together, by behavior, culture, communication, power, and the opportunities we are given or we are denied. For some of you, understanding these forces and empowering communities and pressure in society to change them is what brought you to Harvard Chan School. Let me give you an example of the work in this area. Many of you are aware of the everyday discrimination scale developed by our own professor, David Williams. It gave researchers a rigorous tool to measure something that had long been hard to quantify: what being seen as less than equal does to a person's health over time. This scale has been used in hundreds of studies around the world, helping establish discrimination as a driver of poor health outcomes. And the fact is, you cannot change what you cannot see. It is your turn to make sure everyone sees health disparities and inequities wherever they are, and that we act on what we find. Congratulations. And then there are our health policy and management graduates. We are getting applause in the beginning. You know, better health doesn't come from knowledge alone. It requires decisions, systems, policy, institutions, financing, leadership, and trust. You are the ones who close that gap. You ask how health systems work, how they can work better, and how policies and organizations can improve lives at scale. And you take what science discovers and turn it into action in the real world. And look no further than this school's alumni. Since 1962, 8 directors of the Centers for Disease Control and Prevention have been graduates of Harvard Chan School, including William Fahey, who developed the strategy that eradicated smallpox, the only human disease ever eradicated. And of course, Rochelle Walensky, who led the CDC during the COVID-19 pandemic, and who is here with us today. It doesn't stop here. Gro Harlem Brundtland, former Director General of the World Health Organization, the WHO, is also a graduate of our school, and countless health ministers and leaders who turn science into action all around the world. And some of you, I'm sure, may join these global leaders. But I have no doubt all of you will make major contributions to benefit people wherever you will be. And we are grateful to you. And now, I want to celebrate those of you who choose not to specialize in one field in particular. Because public health needs specialists, but also needs integrators. People who can bring many forms of knowledge together and turn it into action. You will move across fields, connect ideas, and see the bigger picture. You'll knit together so many different aspects of what it means to be healthy. And we are grateful for what you'll make possible in the world. Congratulations. And finally, let's turn to those of you who have chosen to take on public health on a global scale. Global health begins with a simple truth. Health does not stop at borders. A virus can travel across continents. War and displacement can affect the health and human rights of millions. A policy decision in one country can alter the life chances of people in another. So it is about understanding how the world is connected and how this connection shapes who receives cares, whose dignity and rights are protected, who lives, and who is left behind. And here is one example of the legacy you are now part of. In the 1970s, when cholera and diarrheal disease were killing millions of people around the world, our own Richard Cash helped develop oral rehydration therapy. It was a simple and inexpensive solution of sugar, salt, and water. Very simple. It saved tens of millions of lives ever since. Tens of millions. That is the power of global health. And we applaud your commitment to the field. The fact is, public health can and does achieve extraordinarily ambitious goals. No field touches more lives. Class of 2026, you chose public health not despite its challenges, but because of them. And we see you clearly. You carry forward not only knowledge, but courage and the deep conviction that human suffering and inequities are not inevitable. And I know you are ready. You are ready to face whatever challenge comes your way. In the years ahead, you'll carry the school legacy forward. 100 years from now, I can imagine the dean of this school standing at a convocation ceremony much like this one and telling future graduates about the class of 2026 and the mark you left on the world. And let's talk about that mark, because if your generation manages to add healthy years to people's lives, who knows, I might even be at the convocation. It has been a privilege to know you, to teach you, and to learn from you. And I know all of our faculty feels the same way too. So, class of 2026, congratulations.